So there are a lot of different factors to consider when choosing an MS medication. There are over 20 different options, 10 different classes of medication, so it really requires an open dialogue between you and your physician. So with regards to MS treatment, there are acute treatments that we use for flare-ups, and then there are long-term sort of preventative medications that we use to prevent worsening of MS. And so your physician may look at things like severity of the MS, subtype of MS, any other conditions you may have or any medications that you're on, your age, and factor all of those in. And then, so once your physician hopefully has narrowed down the options they feel are right for you. So a lot of different medications are very, very similar, but may differ with regards to how they're administered. So whether they're administered every month or every 6 months, whether they're a pill or an injectable or an infusion medication that requires an infusion center, those types of things are open to discussion. And I think you really have to factor in your lifestyle, your values essentially, and your risk tolerance is important. But what we mean by that is that there are some medications that are that have a higher risk, but that may have a greater benefit with regards to controlling your MS. And so really that discussion of risks and benefits of certain medications is a really important discussion to have with your physician. I think there are a number of important questions to ask your doctor when considering a new treatment option. Number one is how this will affect your lifestyle, or will it affect your lifestyle? Some medications don't do that. If you're planning to start a family, for example, will that require more planning? If you have a busy schedule or you travel a lot, how will that interact with your medication? Ask your doctor about the side effects, about tolerability, about safety issues. Really try to get as much information as you can about a medication before starting it. In the modern era, we really have lots of different options. And so somebody that may start on a medication, if that medication doesn't end up being a right fit, we have the ability to switch options.